My Team 8 now, the leaders of Indiana's largest hospital chain, say they'll invest $1 billion in community health initiatives. It's part of the hospital's push to bring down prices and improve service. News 8's Garrett Bergquist investigates the numbers.
Well, I mean, IU Health is certainly the highest in the Indianapolis region based on a multiplier Medicare. In terms of absolute prices, it's the highest in the state, about 50% higher than the national average. Their profit margins are 4 times the national average. They are the biggest culprit, but the good news is they have announced that they're going to reduce their prices to the national average by 2025 or before.
But Hoosiers for Affordable Healthcare's Al Hubbard says he doubts IU Health's new community investment plan will further that goal. It includes $500 million for what it calls health-related community development around Indianapolis. Another $400 million will cover innovation related to key priorities, and $100 million will go to the IU Health Community Impact Investment Fund. Past investment areas have included nursing programs at Ivy Tech and workforce training at the new Mosaic Center. Hubbard says that money should go toward core services instead.
You know, their focus should be the following: highest quality service possible, great service, and low prices, and don't make any more money than is absolutely necessary. And they're not doing that.
A 2020 RAND study found the average hospital in Indiana charged insurers more than double the average price Medicare would have charged for inpatient procedures and more than triple the Medicare rate for outpatient procedures. IU Health charged even more, close to 3 and 4 times the Medicare rate, respectively. Hubbard called out Indiana hospitals in a Wall Street Journal editorial published this month.
This is really important to our community. Not only does high hospital prices hurt the pocketbooks of all Hoosiers, you know, it hurts employers, so they cannot pay Hoosiers more. They cannot expand the workforce.
IU Health did not provide further details about its plans and turned down our request for an interview. It has previously announced a 4-year price freeze as part of a plan to reduce its prices to the national average. In Friday morning's announcement, IU Health President and CEO Dennis Murphy said, "We will also need to focus on the other drivers of healthcare costs, such as lower public health funding and cigarette taxes, utilization rates of healthcare services, insurance costs, if we are serious about controlling healthcare costs in Indiana."
The Speaker of the Indiana House and the Senate President Pro Tem sent a letter to Indiana's nonprofit hospitals last month. IU Health's hospitals are nonprofit. They say they want hospitals to reduce their prices to the national average by the beginning of 2025. They set a deadline of April 1st for those price reduction plans. Otherwise, they say lawmakers will pursue legislation to reduce prices through state statute. Garrett Bergquist, Wish TV, WishTV.com, and follow us on Facebook.